At 1 day old, a newborn named Nicholas began showing signs of hypoxia. Hypoxia is the medical term for low oxygen levels of the blood, and common symptoms include bluing of the lips and bluing of the fingernails. Nicholas was immediately moved to the intensive care unit and placed on oxygen. Multiple invasive tests were run on him in an effort to determine the cause of the hypoxia. However, no test was conclusive. One specific factor truly tugged at my heartstrings about Nicholas. He's my son. There's nothing more frightening to a parent than to see your child have a potentially life-threatening health issue. It was one of the most difficult things that I have ever been through. My biggest problem was that I wasn't acting like his dad, who's a chiropractor. I was acting like his dad. I was so terrified with the whole experience that I wasn't thinking or acting rationally. After thousands of dollars of testing, multiple needle sticks, doctors were no closer to finding the cause of the hypoxia. The team of specialists involved with my son's health problems had no explanation of why my son was suffering from hypoxia. The specialists included a pediatric neurologist, cardiologist, a respiratory and gastrointestinal specialist. When they all exhausted all of their possibilities, they came up with a very general, very nonspecific, and as far as I'm concerned, medically irresponsible diagnosis. You see, we were told that they believed by default, since all the other tests were negative, that our son had acid reflux, and that they would like to start him on acid reflux medicine. That's when I reached that critical point that I stopped thinking like a dad and started thinking like a chiropractor. The child is hypoxic. He's not getting enough oxygen. His issues had nothing to do with acid reflux. I picked him up out of this little ICU bed and I asked God to help me find what was wrong. And as I lightly touched his spine, I felt a tiny vertebra out of place in his upper back. The T3 vertebra is at the top of the shoulder blades. Interestingly, the destination of the nerve that exits that level goes to the lungs. As I lightly pushed on the vertebra to realign it, we actually heard a pop. One wouldn't expect to hear an audible pop out of a 5-day-old infant, but it was that far out of alignment. No other doctor took a second to look at that. My son's hypoxia symptoms stopped. There was no more need to administer oxygen. The hospital, still concerned about the oxygen levels, wanted us to take home a large machine that we had to hook my baby up to for 2 straight weeks every time he slept. Not only did the machine's alarm ever sound, he never took acid reflux medicine. I wonder sometimes how many parents are out there that aren't getting the answers, that are getting that by default diagnosis. Or even worse, how many parents are out there that don't even know chiropractic can help them? If you haven't had your kids checked, please do. Or if you know a friend or family member that has an unhealthy child that can't seem to get healthy, or they can't get the answers to explain their health issues, send them to your chiropractor. You see, the time to find a chiropractor isn't during times of desperation. It's when you might think you least need them. So please, get your child checked today.